So, do I like nursing? The answer was yes.
So I was speaking in Finnish actually, but then I was like, Finglish, like Finnish and English, you know.
mix, yeah.
So she was impressed. She asked me, how long have you been here? I told her 3 months. She said, 3 months? Oh, that's impressive. I'm going to give you a chance.
Nurses need 3 key talents. Use your hand, use your heart, and use your head. And that's enough.
Hello everyone, welcome all of you for the Talent Boost podcast season 2, and I'm Jinadi, your host for today. So in this season, we are hoping to bring you an interesting discussion with the Finnish companies in the field, and keep in touch with the social medias. Your episode will coming soon. So in this episode, we are talking about the field of nursing, and especially in Central Finland. And for that, today I have 3 guests with me. And here I'm turning my first guest. And then she is the Chief Executive Nursing Officer, CNO, in Central Finland Wellbeing area, and the President of Finnish Nurses Association, Helja Laine. And it's really thank you that accepting our invitation.
Thank you, Jinadi. It's really great to be here.
Thank you
today.
so much. And then I'm turning to my colleagues, and they are nursing students in Jamk. Also, they're student nurses in the field, both public and private sector. So welcome, Rabera and Fateme.
Thank you so much.
Thank you.
So then let's gonna start our discussion. And so, how are you doing these days? What is your life? I just asked a general question. So how are you doing? Are we adapting to the summer? Are we waiting for summer? How about the weather and everything going with you guys?
I'm
Waiting
really-
for a Finnish summer, I guess.
Yeah.
Okay.
It will come or it will not come.
Yeah.
It's a surprise.
I feel like we're coming back to life with spring, you know, springing back to life. From
Yes.
winter to life.
Yeah, light.
Light.
Okay.
Long days.
Yes.
Long days.
Yeah.
And then
More happy.
more happy?
Yeah, we are the happiest land.
Country in the
country in the world. Yeah.
Seventh in the row.
7th time in the row.
Yeah.
Right.
That's really okay. So I have like a really interesting question, and this question is like really eager to me to ask in the beginning, because I think our viewers also would like to know the histories and stories behind, like, because when we give the inspiration at the beginning, it will keep them like catch their attraction until the end. So I would like to ask you, what leads you to become nurse? And then what makes you to become like your current position? And I like to know that story.
Okay, let's go for the story. In my high school, I was really interested in chemistry, biology, psychology, medicine. And I was thinking what I'm going to do when I'm an adult. And I applied to medicine as well, and in nursing school at that time. It was year 1986. Oh my gosh, I was 21 when I was graduating.
Okay.
Yeah, 88. It was 1988. And at that time, the nursing studies were like an old-fashioned kind of studies, so it lasted 2.5 years.
Okay.
I did it in Pori, in southern part of Finland, and it was kind of basic studies for nursing. And then I went to work, and that was kind of life school for me in many ways. So I started in Central Hospital of Satakunta in Pori.
Yes.
You might know the
Yes,
Pori
I know.
Jazz Festival. I guess you know at least.
I don't.
I heard that city.
Yeah, and I started in internal medicine ward.
Yeah.
But we also had a kind of step-down unit for heart patients, like a mini CCU. And we have internal medicine patients and we have a lot of heart patients. At that time, we also had patients who needed respiratory care.
Okay.
And they were in normal wards. So with a very bad prognosis, usually.
Yeah.
But that was, as I said, it was like a lifelong learning at that way. And I really kind of learned to resuscitate. I really learned to take care of the patient with a low number of nurses at that time. I learned to take care of the near ones who have lost their loved ones and different age of people and those. So at not so high-tech devices at that time. We
Yes,
have
of
monitors,
Yeah.
but even the respirators were those that you need to have a clock where you take the time, how many breaths per minute
Yeah.
it will take and so on. So that was a bit rough.
But it's all
I should
hand-on
say.
experience.
Yes. And then I worked, it was 3 years, something like 3 years, and then I started my specialization. So I graduated as specialized nurse in 1994 in Turku.
Okay.
And at that time, I also worked in the Turku University Hospital in intensive care. And there I stayed. So I've been working over 15, almost 17 years in intensive care. And that was really my area. It was intensive care unit for adults. And we have different kind of diagnosis. Some children also, mainly adults. So that was a very learning time for me. And I should say that if you have managed there, you can manage wherever you go.
Of course.
Yeah.
I'm really proud to be an intensive care
Yes.
nurse in a way.
Beautiful.
Yeah. So I started my university studies after that master thesis, and then I graduated my PhD in 2013. My thesis was about decision making and information needs in intensive care. So I carry on that
Same field.
same field.
Okay.
Yeah. Yes. And I got my associate professor title. It was in 2018. I have some students I support with their PhD students and some master students. I love to do that work as well. I don't have so much time for that
Yes.
nowadays,
Yeah.
but
Yeah.
yeah.
Sounds nice.
Yeah. it's
Shortly,
really-
my story.
Yes, it's really interesting, and
Yeah.
I
And a
felt it like
beautiful story.
it's full of knowledge. Like
Yeah.
it's a full package of knowledge right now. It's
Yeah.
like experience and learning, and
Yes.
yes,
Yeah.
okay. Now,
And other fields also. So I also done my executive MBA 2 years ago. So that's
Okay.
something more than
Yeah.
just nursing.
Yeah.
For
It's like-
management.
it's like a great inspiration to us continue the studies.
exactly.
By the way,
Yes.
No giving
You have a
up.
long
no,
way.
you
Yeah.
have long maybe, or
Yeah.
just beginning. So
You can go wherever you like.
Yeah.
So
Yes.
path is open.
Open.
The
I
sky
should
is
say.
the limit. Can we
Yes,
say that?
that's right.
Yes.
Or maybe not.
Taivasrajana.
Taivas.
Ryan. Yes, and then here you are in now Keski-Suomi.
Oh, yes. Yeah. So I came here 2017. I started first in the hospital district area as a CNO. And then 2022, was it one? When the well-being area started 1 year ago.
No, it's
1 year ago.
22, I think,
Yes.
because when I was
Yeah.
at Kaupunki
Yeah.
Exchange.
Yes. So I started as a CNO in this whole area. We have approximately 12,000 workers, and 60-70% of those are not just nurses, but those who are working in the nursing area.
Yeah.
Okay,
So
like it's
like 7,000.
okay, it's been
something
like all healthcare field professionals or okay.
Yes.
That's quite interesting.
It is.
Okay, then I will turn the new characters in the field, like just the beginning, the buds of the flowers. I will ask the questions. So, like this question gonna be a little bit fun, but like I think when I go my first job as a nurse, the Finnish nurse first asked me, like everywhere, okay, why you moved to Finland?
Yeah.
And then why you choose to do nursing in Finland? So
They are
Here we
curious
go.
about it. Why?
here we go with you.
You can start.
Okay.
Yes.
I can start. So, my name is Rabera and I'm originally from Kenya. Yeah. In Kenya, we say jambo to mean hi. So, I've been in Finland for 2.5 years now. And the reason why I moved to Finland is because, one, it was a cheaper opportunity compared to other countries. And two, it was a new country for me. The first time I heard about Finland was when Sanna Marin became the prime minister, because it was like a big thing in the whole world.
Yeah.
Such a young woman becoming in such a big position. So I felt this country is small. It has small population. It's the happiest country in the world.
Of course, yes.
And education is good. And I want to be a nurse. So why not pursue this opportunity? But it felt to me like a miracle because my friend shared with me the opportunity to apply. So we were like, let's apply together and go be in the same country together. But I got the opportunity and he didn't get. But he's the one who shared the opportunity with me. Later on, he applied and he got, luckily. But then to me, it felt like a miracle and like I was meant to be here. So I've always taken like coming to Finland as a place where I'm supposed to be, where I'm supposed to grow and impact people in one way or the other. Yeah.
Okay.
Wow.
Nice.
And I have a background in engineering.
Okay.
So I studied engineering in my country, but then I felt like it's not my thing because I'm more inclined to helping people, like to be with people, to talk to people, understanding people, listening to people, but not machines. So I'm like, okay, this is not my thing. Let me follow my path. So that's why I came to Finland.
You followed your heart to
Following
Finland.
my heart.
Yes,
And the miracle.
of course.
Yeah.
Yeah.
Here we
About
go.
me. Yeah, it's a long story. For me, this degree, it's not my first degree. Before coming here, I'm from Iran. Yeah. And I have studied a bachelor and master degree in my home country, but it wasn't about nursing. It was about law and international law. Yeah. I liked my field of study. And I think in 18 or 20, I never thought about that. I'm going to be a nurse. I was happy with law and I wanted to be a lawyer. So I was studying and keep continuing. But since I started to study master degree, I was kind of thinking about it that is it okay, this rules and these laws in my home country, does it allow me to be that kind of lawyer that I want? Or I just need to follow the rules or everything that the politicians or those kind of political issues, I just need to follow them. Yeah, the answer was just like, it's obligatory and I needed to follow them. So I decided to, after finishing the master degree, I decided to not work in that field of study. And I was thinking about, okay, now what should I do? What do I want to do? I should, again, follow my heart and choose a field of study that I like, or maybe think about it more logical. I have thought about it, and choosing nursing for me, because I have that experience, it was kind of emotional and logical decision at the same time. At first, I thought, do I like it? The answer was like, yes, I like helping people. Yes, I think. Even I thought about different fields of nursing. I was like this, okay, maybe I didn't have the opportunity to work exactly as a nurse in the neurology part, in ICU, in CCU. So do I like nursing? The answer was yes. And after that, it was the big decision, where do I want to go to study? Because I have this opinion that I want to study abroad. There were many options, and Finland was one of them. Same as you, some of the reasons were common with you, but for me, the first reason was like this. I want to go to a country that, again, not after finishing the degree, not thinking about, is this everything here equal for me? So thinking about that, I want to choose a country that men and women are equal in that. So the most important reason that to choosing Finland was this for me. Yeah, I have been searching about it, and I saw that, Finland is in the top. So, yeah.
Here we go.
Yeah.
Right.
Okay.
Right.
Yeah, that's really nice to hear. So here we are. And I also personally believe like the life is sequences and then everything is connected to each other. Might be we are meant to be here.
Yeah.
So let's hope the best. And then like apart from that I would like to know that about the general idea about the healthcare setting in Finland. So that when we talk about the healthcare setting, that's a big scope, that's a really big area. But I would like to know, because I see recently there's a lot of international students are coming for nursing, especially like migrate. They have really big competition for nursing. I think now we have demand on the role. What do you think? What really actual role of nurse in Finland? What do you think about that?
Well, the equality was a good word for that in a way. I guess it is shown in our area, the best way we can do it. But other reasons might be like we have a really good education. The quality is great. Finnish nurses are doing their work all over the world. I think that you have a lot of possibilities in the field of patients and clients in many ways to do your work. You can go, as we already talked, that whatever you like to do, you can go so high you want to go. There are no obstacles for that at all. Yeah. So if you like to study, you can study here. You don't have to have any kind of social status for you, or even you don't have to put it right. You can be poor or you're rich. You can do that in Finland.
Exactly.
So all the education is that kind of free. You can manage.
Yeah.
And you can get support if you need some money for your education. That's a good reason. And that's always kind of surprise when you talk about that abroad.
Yes.
That what kind of healthcare we have. You can get whatever kind of operations. You don't have to get any insurance money or use your own money. And what kind of education we have in healthcare area. I guess those are the main reasons.
I also impressed when I comparing about the place
It's a
that
big
I
word.
grew. That's a big word.
Yeah.
I believe that, people, according to their ages and experiences, they have different goals and wishes. So maybe somebody like me who have more experience have a kind of different wishes. But if a person who is 18 and don't have those much goals to even working or staying in Finland, I can say if you just want to study in an atmosphere that is completely stressless, Finland is the best place. Yeah, because I'm coming from a strict educational system.
Yes.
It's kind of 0 or 100. It's like that. You are the best or not good.
Yeah.
But
Yes.
here,
It doesn't matter.
yeah, exactly. When they tell you it's the grading system, it's 1 to 5. When the first time they told me that 1, it means that satisfying, it's good. I was like, no, no, 1, it means you're
good,
not
not
stupid.
good.
No, not good. And they told me, no, it means you have learned enough. I was like, oh my God. So it's like this. It's not like that, you didn't try enough.
Yes.
Then what is enough?
Yeah.
Yeah.
Yeah, so that's a really good start, like Fatima, because my next question for you guys was like, how was your studies? How you apply your theoretical knowledge while you're doing practice? I was so curious, like, to know about your practices and like might be that like Rabira has more experience than Fatima because you are really near to graduate, so you have practices in really different settings in Finland. So how was your experience, and also how was your mentors guide you? That's another big question, so I love to know about that. Let's talk about that.
Okay.
You can start
Where do
from
I
the
start?
first year, maybe briefly.
I was here for 2 months when I realized that Finnish is very important. Learning the Finnish language itself, it's very important for just living around here and interacting with people. So I had gone to look for a job in a palvelutalo, and they were asking me like, how is your knowledge of Finnish? Then I was like, I can say moi and I can say my name. Then they say that, oh, you can go and study more Finnish, then come back and ask for work. I actually didn't go back because in that 1 month, to make it like 3 months, I took time to watch Pikku Kakkonen and study as much Finnish as I can. So by the end of 3 months, I just woke up one day and walked to one of the palvelutalo in Kuokkala and talked to the boss there, like, I really need a job, and I would go and look for a cleaning job or any other job, but I need a job which is encouraging me to learn not only the language, but also that is related to my field.
Of course.
So I was speaking in Finnish actually, but then I was like, Finglish, like Finnish and
English
you
mix,
know.
yeah.
So she was impressed. She asked me, how long have you been here? I told her 3 months. She said, 3 months? Oh, that's impressive. I'm going to give you a chance. So I started working there as HYVAKS.
Yes.
Remember, I don't have any background in nursing, so it was like my first time. But being there, like with those old people, then you get to learn more because they speak slowly and they are quite understanding that, yes, you don't know. But then if you say something wrongly, then they correct you. So that was my first introduction to Finnish working life, like before I got my first practice. So when it came to the practice time, they gave me a chance to do my practice there. I did it in Finnish. So my OHI, I was like doing it, the supervision in Finnish. I'm like, okay, what do we do now? There is here, bring this, bring that. Then it makes your mind work faster and you want to learn more. So you go home and do your own like homework and like study more. So my first practice was a bit hard because I didn't know much Finnish, but I would say it was rewarding because it gave me like the zeal and passion to learn more.
Yeah.
I want to understand these old people. I want to hear their stories from their older times. I want to ask them, mikä on tärkein juttu elämässä?
Yeah.
Eli how was your previous life, you know? So I learned more. Like I knew more. I learned more. I knew more like that. And my next practice, I did it in mielenterveysyksikkö. It was in Laukaa.
Okay.
Then I did the next one in Kyllö, osastolla 4, and I got a job after that. So
Okay.
like after my practice, In the meantime, I was doing like keikka in the Vuoropari, in the palvelutalo, but then they gave me also a job in Kyllö. So I was like happy, like I'm working in a hospital and I'm in second year.
That's the
so
dream.
It was like, oh, this is good. My Finnish is getting better. I can do like the doctor's rounds, and my doctor is like, oh, your Finnish is good. You're doing great. I'm like, let's go.
Okay, let's go.
Yeah. So after that, then I did my next practice was in Joutsa. Joutsa is like a village, I would say. It's like small, very old people majorly. So most people don't speak Finnish. So that was also like being thrown in like fire, like survival mode. So I have like to learn more. I was lucky to I was living there, so I was living with this old couple. They also don't speak English, so I have to speak Finnish. So like
Here we go.
Finnish is very important, I would say, in all the practices, because however much, yes, you would want your supervisor to speak to you in Finnish, you wouldn't choose which patient you're treating. You can't choose like, I have to treat international patients, so I speak Finnish, so I speak like English. But you have to treat patients in a language that they understand. So after my Joutsa practice, I came to Leikkausosasto, like in the operating theatre. Then I did my practice there. And after that, I got a job in Kirurgiosastolla. That's like post-operative. So that's where I'm working currently. And the next practice, those are like 6 practices already. So the last practice that I've done like recently was in January. It was in Vastasyntyneiden teho-osastolla. That's neonatal intensive care unit. So that was quite good because that is where my heart is, like in the children area. So pediatrics. So I enjoyed it a lot, and it doesn't mean that I didn't enjoy the previous practices, but I had waited so much for pediatric practice that I really had a good time. So I would say all my OHIVAKS, like in all the practices, we have gotten along so well. We may not have been like having the same language at some point, but the fact that you can sometimes use viitomakieli. If you don't understand something, then you're like, oh, it looks like this. Because in the hospital, you can get like something is called as it looks. Like if it's a pistapullo, then someone would say sorsa. Anna mulle sorsa. What is sorsa doing in the ward? Why is there dark in the ward? Things like those. Apinnapu, like monkey tree. Why is a monkey tree in the hospital? Why is it in the ward? But then with time, you learn the vocabulary in the ward. You get used to how the routine work goes, and having like a good team in the ward also helps. You as a student being like oma aloitteinen, like self-initiative. Like you want to learn, you ask questions, don't be afraid. Like you shouldn't be like I don't know. Yes, you don't know, you're a student. You're here to learn, so take that time to ask. So I think that is what has helped me. I ask a lot of questions if I don't know. If I didn't understand something in Finnish, then I ask, voisitko selittää englanniksi, vai can you like put it in simple terms? Yes, in Finnish, but simpler a bit for me to understand, because those people also know this is not your first language. Some of us have we have 42 languages in Kenya. And I have Swahili, and I have English, and I'm learning Finnish, and I've studied Chinese. So it's a lot. So they understand it's not your first language. So I think that is simply like how my practices have gone like up to this moment.
Yeah, that's amazing. You have a really good experience, and I know she has good Finnish skills. I know that.
For the students, your kind of secret is old people, Finnish old people, Pikku Kakkonen. And I guess Aku Ankka would be nice too.
Aku Ankka, that's true.
That's
one of the patients
Finnish.
has given me like that Aku Ankka booklet as a gift. That was so funny.
Yes.
Yeah.
So here you have a lot of things in the field to learn and experience by yourself. So here we go for the main story.
For me, it was kind of different because I didn't start working before going my first practice, which it was, I think it was in the April. So the first semester and second semester was just theoretical parts, and I was going for my first practice. At the end of second semester, I was so kind of at the same time nervous, but it was so interesting for me. I went there. It was the basic of nursing practice, and it was in Muurame, in a HYVAKS or nursing home.
Yes.
Yeah, it was there. If you have been in Muurame, it's kind of different with Jyväskylä, smaller cities or smaller places. Yeah, there was no foreigner in that place, and the only one was my mentor. So it was just kind of like give me the vibe that, oh my God, so the only person that I can talk to that it's only my mentor, because nobody speaks English, only my mentor. But it made me a bit nervous. But after a while, maybe it was a good chance for me. It helped me a bit. I went there, and my knowledge of Finnish was so low. I just have passed 2. Am I right?
Yeah,
we have
Finnish
passed
1 and 2.
Finnish 1 and 2 courses. Yeah, and I didn't know that much. Just like making small sentences. Yeah, and small questions just like that, and it's the name of some of the equipments that we use and these things. I went there and I was like this, okay, I know that I don't know Finnish, but I want to learn. So I asked my mentor that, is it okay that all of the time I keep my notebook and my pen in my hand? I want to bring it everywhere and adjust, right? And I was like a person that all of the time helping, and like, writing this.
Writing
what
all
did she
the
say?
words.
And writing all the words. I was listening. I think I can say in my first practice, I was a very good listener. Every time that my mentor was talking to the patient talking to the nurses, or even the nurses talking to each other, it was so difficult for me to understand, because when the nurses talk to each other, they speak fast, and they use the terms that I didn't know. But I try to use the terms and sentences that elderly use, because they speak so slow and they use the simple words and simple terms and short sentences. I try to learn them, and I can say it helped me really, really much. And I used of that to improve my Finnish, and I was lucky, and I can say exactly after my practice, I could get my first nursing job. Yeah. And I asked my nurse, that my mentor, that if she's satisfied with me, can she give me a kind of recommendation letter?
Like
we have
references.
Yeah,
Yes.
references. Because we have something like that in Finland, that your mentor check your course and write something about your attitude, your everything that you have done in practice. I asked that if it's possible for her that write something at the end if she was satisfied. And she did this, and I'm so thankful. And I started to apply for the job, and I got my first job. It was again in a nursing home, and I went there. My Finnish wasn't that much good, but I think my manager saw that I'm trying and I'm motivated to learn. And it was just like that. It's not like they give you the contract at the first day. They tell you, okay, come for 1 week or 2 weeks. We would see that how is it going. And I think, as my colleague said, they saw that I am really interested in learning in nursing fields and even in Finnish. So I'm thankful they have trusted me. Yeah.
Okay,
Right.
that means like you have quite good progress, Sue.
Yeah, exactly. One by one, it wasn't so fast. I can say, don't be disappointed. Finnish is a very difficult language. We all know that. Yeah, and it takes time that you learn. It takes time. Yeah, just continue. Yeah.
How about your recent practice?
Yeah. Oh, you know about it. Thanks that you have mentioned it. I have started working. So since last May, I have been working in my workplace. And recently, I had my second practice, medical nursing, in Hospital Nova.
Okay.
I am so happy. Yeah. When I saw that the name of Nova, it's you check your ability to see where is your practice placement. I saw Nova. I said, yes.
No osasto, just Nova.
Yeah.
Yay.
Yeah. Then I checked it was neurology ward, and I was like, really good. I can say totally, if I want to say so briefly, I met some people, nurses, and even the physiotherapist who were really kind, and they were really professional. Nobody didn't look at me like just a student. They were they asked me, can you do that? Or if you want to do that. And I was like, this is something that a kind of a nurse do. Am I don't know, can I do it? But when I saw that, I could see the trust in their eyes. They said, yes, you can do it, no worry. And I have tried it, and I can say it takes me less than 1 week in Nova, in neurology ward, that I could get the trust of the people to call me that, come here, you can help. Because they know that I like. And I told everybody, please, if you are going to your patient, because my mentor just have 1, 2, 3 your patients, but if you are going to different patients and if you need help, please call me. And sometimes it was just like that. Even the physiotherapist tell me, if you want to learn, come with me. I was so happy. Yeah.
That's really
nice.
good.
Yeah.
That's really, really good.
Yes.
Oh my God.
Nice to hear.
Yeah.
Yeah, exactly.
I will tell that when I go back to Nova.
Yeah. I even
them.
mentioned to them, they have changed my mindset about working in Finland. I'm so thankful.
Yes.
It's so impressive.
Lovely to hear.
Yes,
Yeah.
yes, of course. You told me earlier, so
Yeah.
yes, it's a kind of a game changing, and it's really nice that it's coming from the local people. So it's an inspiration for the international, I think. So as I believe. So I think you continuously answer my old question, and I don't have the one that I prepared anymore. But let's go about that possibilities to new students in their practice placement, especially well-being area, because that's kind of a tricky question, because it's once again and always it's the language. So we know about it. Let's talk a little bit later, deeper in language. I have the questions, and let me they might have some kind of scope that they can have for semester. Okay, of course we have a lot of students, but we are taking patients. Meanwhile, we have this much students we can have, and also the mentoring skill also someone should have to everyone might be not in the feel a good feelings to do mentor for someone. So how is the possibility, and as a CNO, what is your opinion about that thing, Lo?
I think the one reason for this that we are kind of not willing to take any more students is that also our own professionals, they are afraid that I am not good enough with the language, or not good enough to show my professional in other language. So we do need support for our professionals as well.
Of course.
I think that even students might be those who can be mentors in other way to the professionals.
Yeah.
So helping them to find their courage to do the things. And it's okay to speak bad English or bad Finnish.
Yeah.
If I try to speak some other languages, I'm sure that you can understand if I knew even a few words, other language. So we do, as in Finnish, you can say some words and I can guess what was the meaning.
Yeah.
That's not so difficult at all.
Yeah.
Of course, we are competing with those students who are speaking Finnish as their mother language.
Yeah.
But it would be nice to hear from you what kind of ideas you have to make it more kind of comfortable, or make more courage for our professionals to mentor students who are not speaking Finnish. Is there any kind of Opinions or kind of good ideas?
Actually, if I can talk about my mentor, she was like, I know that I'm not speaking Finnish in a proper way. And I know that
in English, yes.
In Finnish.
Okay.
Yeah. And I'm not making, and I'm making mistake when I'm talking in Finnish. But she was kind of encouraging me all of the time and saying, wow, you speak so well, but I cannot speak English. I was like, no, my Finnish, it's look like your English. So just try to communicate with each other.
Yes.
Yeah. She was worried about her English and I was worried about my Finnish. So I just told her that just no worry, let's talk. And I don't say that you said that sentence wrong. And we were encouraging in each other that you said it right. I got it. It doesn't need, don't worry. I understand what are you saying.
Yes.
Yeah.
So it's just basically the courage.
Yeah.
Like,
I guess it is.
Yeah.
I guess, and I think that we are too strict in that way that we are looking for that our employees' responsibility is to make sure that the language is good enough.
yes.
Yeah.
So if you can make yourself understandable and if you can report or write even words, so of course it depends. If you are working in intensive care, it's quite fast and you have to know what doctors they are telling you and you have to understand that. But not all the places are not like that. So you can manage. I'm sure that there are some kind of rules or as I said, that we are a little bit too strict for.
I think we are like seeking perfection, as you
Yes,
say, like
yeah.
we want to be perfect before we do something. We want to get perfect in a language before we can speak it.
Yeah.
But how about managing with that little that we know? Because the main point here is that we communicate. The other person understands me, I understand them. Someone can just say kipu and I will know they are in pain, even if they don't have to say a long sentence. So I feel like it's about like striking a balance between the international students and the nurses, the like supervisors, because you will be given an international student. It doesn't mean that you shy away from being their mentor. They can learn a lot more from you, not just a language, but even how you do things, how you handle your patients, how you write reports, like just being patient with us. Like we are doing this for the first time and it doesn't have to be perfect. It will be messy. It will be very imperfect, but we will learn. Give us the grace to learn a new language and to integrate to the community. So patience and a little bit of grace.
Yes. Yeah, right.
Yeah. Päivä kerrallaan.
Päivä kerrallaan, that's right.
Yeah.
That's right. We are not so good with small talk or older people might be a little bit shy and of course the English is not so good with them. But we are in an equal level in that way you can't speak Finnish
and I
can speak English so well. So
Yeah, and I don't know why I saw this between the healthcare workers, why they are so worried, Finnish people, about speaking English, while they are good in that. They at least it's satisfying. I see my colleagues who are nurse at work, and when they have a new student, it's coming, they are just like this. Oh my God, I need to speak English again. I told her, you speak English very well. I don't know why. Every time
don't be shy.
Every time she's worried about it. 1 month, I need to speak English. And I think this makes her, it makes it more difficult for her. It passes maybe more stressful for her and for students. If they just don't be that much strict about her language knowledge, it takes easy. I see that they can communicate very well. But again, they are shy.
yes. Yeah. And I guess the one reason, maybe it's not so anymore, but in Finland we used to learn English really like saying everything right, every prepositions, everything.
In the school when you're learning.
You
when
had
to
be
be
9
really
years
correct.
old, so you have to do everything just
correctly.
right.
Yes, the grammatically correct everything
Right.
should be. Yes. So I think so. It's like the both sides should learning. It's like a combination. You helping each other.
Yeah.
And like for me, as also the same that I met a lot of people who can speak and who can a little bit hard to speak, but and overall, I think they have good knowledge, but they're a little bit shy to show it. Like, and one thing, like I would like to say, you are the one who, like, has to help us to learn Finnish.
Yeah,
Other than
exactly.
who gonna help us to learn Finnish?
Yeah.
Like when we coming to hospital, you are native speakers. Other than we don't have any resources, so
Yeah.
please help us, please.
Yeah, especially in the first practice, which
Yes.
it's mostly in the nursing home, the first
Yes.
practice. It's really good that you encourage the students. They are just first year students and they are trying to make I don't know, they are trying a new experience.
Yeah.
So it's really
The first
important.
time in healthcare sector in
It's
Finland.
really effective for them that how you treat or the other colleagues treat them.
Yeah, that
Yeah.
I think the first impression will go through until the end. So it should be like, I'm not saying it should be, but if it is nice, so it can be good for the future. So I think in Finland, it's future getting more internationalized, I think. So from my point of view, it means like a lot of people are coming to study and like we have international degrees, but then it's like once again, it's like helping each other.
Yeah.
In any field, it's not in like nursing or other sectors, everyone. Like
I think that the healthcare professionals, they sometimes they hide behind. We have this law or act on status or right of the patients. So of course our patients, they have the right to have their services on their own mother language,
yes.
like
Yeah.
English or
Of
not
course,
English, Swedish or Finnish or in Sami language in northern parts, but that's not kind of good reason for that, why we are not doing that.
Okay.
So, yeah.
Yes.
And of course, there are some reasons like medication administration.
Yeah.
Of
You have
course.
to know certain
The
concepts
words
and
and-
words
yes.
and so on. So they are really important, but you can learn.
Yeah.
Yes. So I'm hands down saying that if you are working in healthcare sector in Finland, you should have to learn Finnish. It's take time.
Yeah.
That's
Yeah.
what
Yeah.
everyone should
Yeah.
understand. It's
Yeah.
take time.
Yeah.
I think also considering what you said that we are competing with native speakers,
Yeah.
native nursing students to find practice places, it becomes very hard because for
Yeah.
them it's easy. They speak Finnish language, so they can get anywhere that they want.
Yeah.
But if someone doesn't speak enough Finnish, like satisfying Finnish, then they might actually end up doing all their practices in palveluttalo.
Yeah,
Yes.
exactly.
They may
Yeah.
not get a
Yeah.
chance
This
to
is
go
so
to the
important.
hospital. So
Yeah, that's right.
that in itself, it's like it kills someone's motivation. Yes,
Exactly.
I want to go. Maybe I'm interested in surgical ward. I'm interested in operating theater, but I can't go there because my Finnish is not enough. But how about then there is someone there guiding me in English? Then I'm able to learn. Like, because when we come like to the international classes, then we are taught in English with an expectation that there will be guidance in English as well in our practice places. But then it becomes a bit hard when the nurses are a bit shy to speak English and we have to put more effort in learning the Finnish, but the other side is a bit like pulling back. So when we pull
Yes.
together, this one pulls a bit closer and this side pulls a bit closer. Then we meet at the center and we are able like to
Yes.
balance. So however much, yes, our learning skills are different. It doesn't mean that when I learn Finnish faster, that someone else will also
Of
learn
course,
faster.
yes.
Yes.
So understanding that people are different and they learn differently, then we are able to be more accommodative and considerate, I feel. Yeah.
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 But you are changing the world. You are really important persons for that. I'm sure about that. It's
Yes.
Yeah.
certainly like that.
And as Robert said, I also agree with that people take time. It's different with the skills.
Yeah, that's true, especially for the working. But as she mentioned, I think if our nurses try to speak, I know that they can. If they try to show that they can, at least to the schools, for example, to Jamk, It's not like this that when you ask for the practice to be in hospital, they don't say they take only one English speakers per term or
Yes.
per year. This is so disappointing.
I know.
Yeah.
I agree.
Yeah, exactly.
Good thing we are here with you.
Yeah. I hope we will change in next semester. We will have like 5 students from the Bachelor of English batch.
Yes,
taking
but
for the
one of our hopes from the practice side is that you should speak some Finnish
Of
when
course.
you are
Yeah.
finishing your graduation. That's really important.
Yes.
And take some pressure to do that.
Of
Yeah.
course.
Yeah. Very important.
Yes.
Yeah.
So then let's talk about the graduating students. So what do you think like nurses, what kind of skills that have to work, especially in the board? What do you think like we talk about the Finnish, of course, we need, except that just graduating for a paper is not enough, I think. You have to be skillful, you're dealing with the lives of
Yes.
the human beings. So what do you think about your staff and then overall as a nurse?
Well, you do have to have the paper, of course.
Yes, of course. Yes.
That's the
Otherwise,
first
no
rule.
working contract.
Yes. Use some time to get a good papers in that way. And language skills, they are important in many ways.
Yes.
So even the basic level that you learn to speak something. You have already mentioned that you have to be kind of active by yourself.
Yeah.
Yeah.
Ask,
Yeah.
tell you
Yeah.
are interested.
Yeah.
Yeah.
Be brave in that way. Try to keep the spirit up.
Yeah.
Yeah.
Nursing. I always like to talk about the nursing spirit in a way. We are in a one community, and I guess that we understand each other
Yeah.
really good. I might be an example of the life learning in a way. So keep on learning. I think that most of the areas in the nursing are that kind of areas that you have to be active
Yeah.
in learning. One concept I tried to figure out was the kind of that what nursing is. It's mainly the person-centered care.
Yeah.
So that's kind of our goal in our work all over wherever you are working. Teamwork.
Yeah.
Teach us to work as a team and work in a team. That's my advice for that. And collegiality or collegiality, how you
Yes.
say that in English, that's really important.
The quality of your work.
Yes,
of course.
yes. And honor your colleagues
Yeah.
and
That's
show
really
you are good. You don't have to be ready when you have graduated.
Yeah.
Yes. You're not perfect.
Yeah,
You're not a perfect
yeah.
package
Yes,
when you're starting.
that's
So
right. That's
it's a
right.
practice. You give from your story that it's how much it's take to practice, like handful experiences.
Yes.
Learning will
Yeah,
make you the
yeah.
best.
Yeah.
Yeah, even you can take the trust on work like this. Finnish Nurses Association presidential is a trust work for me.
Yes.
So I don't get any salaries for that. But
okay.
that's really important for me. We have a full-time CEO working there in Finnish Nursing Association, but it's really, really important. I'm so proud to be part of that community as well. So it's our professional community and
I would like to know a little bit more about that, and then how the people can if they wanna be a member, or so how is the process is there?
You can find our pages in websites.
Okay.
You can be a student member.
Okay.
It's free.
Okay.
We have every year this big happening in Helsinki, sairaanhoitajapäivät. It will be next, is it November?
Okay.
September?
Okay.
October. I
Somewhere.
guess next year. This
After
year. I
summer.
should know
But
that.
this year,
After
They
summer.
don't like when I say I don't know anything.
Okay.
they're gonna see this.
Yes, they're gonna see this.
It's gonna happen this year.
Yes, yes.
Do we wear scrubs for that day? Do people wear scrubs?
No.
No scrubs?
No.
Yeah.
Yes. No. And we do have this big happening. I was already telling you that we will have 2025, this international nursing conference in Helsinki, and it's really, really big. I was attending that last year in Montreal, and we had there 6,500 nurses all over the world.
Oh.
And it has been in Helsinki 100 years ago.
Oh
And it was
my
Sophie Mannerheim was at that time president of the Finnish Nurses Association. It was Swedish association at that time, and Sophie was sister of our president Mannerheim.
Okay.
Oh.
So really, really important woman at that time.
Okay. Finland has a history with nursing,
women.
you know?
Yeah.
And
We
also
like
with
women.
women.
Yes.
Yes.
That's cool. And then we're going to have the next one, 2025,
Yes.
as you said, in Finland.
Yes.
So
and
here
student
nurses.
assemblies will be there as well.
Okay.
Wow.
So that's going to be a great news for our viewers. So
Yes.
you can save your calendar for 2025. That's go to international conference
Yes.
in Finland.
Yes.
So
It's the beginning of June
okay.
2025.
That's a good time. We are in holidays.
For midsummer. Yes.
Yes. That's incredible. So here we are coming to the end. I think it's a really amazing, and I didn't even feel like that we are taking time, and then it's getting more and more bigger. And then I asked both of you how was your feelings for this so far? And I hope as you said that when I listen to your stories, everything is going smoothly, but your experiences always will change you. So, and what is your advice for future nurses? Especially it might be you're as students in the field, so they would love to know what our seniors are saying about this thing. So I would like to know, for international students, also the local students and everyone. So what, briefly, what are you going to say?
I think if I want to just say something to international students who are thinking about it, that is Finland, or especially Jyväskylä, is a nice place to study nursing. As I mentioned in the beginning, if you are looking for a stressful educational system, which it has a very nice quality, and you want to be sure that you would be qualified to work. Maybe you don't want to stay in Finland. Maybe you want to go anywhere. You want to be sure that your degree is acceptable everywhere.
The quality one.
Yeah, exactly. This is so important. It was so important for me that is the degree acceptable in other countries?
Yeah.
Yeah. And if you think about it, here is the place. Yeah.
Okay. What about Roberta?
Oh,
Ooh.
what can I say? So if that is your passion, go for it with your whole heart. And don't do it for people. Don't do it for money. Do it with your whole heart. It may be a stressful career, and sometimes you may think, why did I choose it? But then you remember you are helping people. You're making people's lives better. The thank you that they say, the small cards that they write when they are leaving the hospital, it brings joy and fulfillment. And you who is coming from a different country to learn a different language, give yourself grace. You cannot know the language as fast as you want, and it can be frustrating at first. Getting a job will not be easy at first, but give yourself grace. Be patient with yourself. Do not compare yourself with any other person. Yes. We all have different paths, and some of them can be messy, really. But at the end of the day, just do what you have to do, one day at a time. You'll get there. And I believe in you. I do.
That's an inspiration. So, what is your advice for future nurses?
I would like to say that please stay in Keski-Suomi area.
Course.
We have an excellent education here. We have really good quality with our teachers. And you will have a great colleagues here in the future.
Course.
You will have an excellent managers here in nursing, representing the whole Finnish area in Finnish Nursing Association. And as a manager, I would like to say that nurses need kind of 3 key talents. Use your hand, use your heart, and use your head. And that's enough. You will survive.
Sweet.
Yes.
Yeah,
That's
true.
briefly it.
Yeah.
And thank you so much once again for all of you and participating for this. And I think it's really gonna be amazing episodes. And
And I'm
Maybe,
so
maybe.
proud of you too.
Thank
I'm so
you.
proud.
Thank
you.
you.
Thank
Thank you.
and then thank you so much and have a good day and see you in next episode.